As that takes place, I want to share just a few things, and that is, as a reminder, the Sheriff's Office, by executive order through the governor, is required to enforce the governor's orders, and issues of non-compliance with these orders will result in a misdemeanor crime. Governor Kemp's orders continue to assist our city, and more importantly, the state with stopping the spread of the virus. We have to remain Augusta strong, and in order for us to do that, we have to stay home and stay safe. To that end, I want to remind the citizens of the importance of adhering to the restrictions in place, as it will take each of us to collectively achieve this goal. The safety and well-being of all of our citizens continue to be our #1 concern and #1 priority. With the extension of the governor's shelter-in-place order until April the 30th, it is imperative that we reiterate what it means to shelter in place. To that end, sheltering in place simply says to stay at home. If you have no reason to come outside of your home other than for essential work activities, to attend the grocery store and conduct shopping, to visit a pharmacy, or to visit a medical facility. If you leave your home, you're advised to once again wear a face covering or a mask while out in the public, pursuant to the governor's executive order on the 13th of April. Please be sure to continue to practice social distancing, and particularly in group settings where the guidelines of 10 or less are still in force. I'm encouraging all of our citizens to wash your hands while keeping your hands out of your face. Stay home if you're sick. The same holds true for the City of Augusta employees, but even in the private sector. If you are sick, stay at home. Call your employers, but more importantly, call your doctor, your primary care physician, instead of going immediately to the emergency room. As we continue to navigate through this, we're being advised by the Centers for Disease Control as well as the State Department of Public Health. We remain in constant communications with our local, state, and federal agencies regarding the situation, and we'll continue to keep our citizens informed. As we've indicated, we will have a weekly briefing in order to be able to do that. I want to inform all of our citizens that core services continue: trash pickup, water, our law enforcement agency, fire services. All of these services continue as scheduled. I want to encourage everyone who's watching and listening in that if you want to receive daily updates or updates as it relates to COVID-19, please visit the Augusta, Georgia website, and in particular the COVID-19 webpage for email and text updates. Regarding our parks, there's been a lot of discussion about our parks over the last several days, and quite frankly the last week. I want to remind everyone that our parks remain open. Not only do our parks remain open, but the Augusta Municipal Golf Course is open as well. And the rationale for this decision is that there's no clear science that dictates that closing parks will reduce contacts or significantly change the trajectory of the virus. But there are both mental and physical health benefits associated with parks, and complete closure would have unintended consequences. Our health providers have told us that while the goal is to increase social distancing, and appropriate social distancing can in fact be obtained in parks with appropriate controls and community compliance. At Augusta Parks, we have posted signs that indicate to all who visit our parks and our facilities that you should conduct safe social distancing. Those signs, again, provide guidance with regards to that. The consensus around parks is that complete closure of all parks will have a disproportionate impact on minority populations. We will not allow that to happen. Our staff will continue to monitor hotspots around the city, and as necessary, EMA and law enforcement will be on the front lines of enforcement as it relates to that. I want to thank all of our citizens again for their commitment. I think the sheriff is going to share some things that, as it relates to, again, stay home as well and sheltering in place. But I want to, as an aside, before he comes to the microphone, just remind everyone, we are living in unprecedented times. This is a moment, particularly as we celebrated Resurrection Sunday and Easter, that was different. It's different not just as someone who is a man of faith, but more importantly, who leads a church. It was different. But I'm pleased with what I saw in general, where congregations again followed the CDC guidelines and the directives that the governor provided. But we still have more work to do. We have more work to do in keeping people off the roads and staying at home. And with that, I want to encourage everyone, continue to be Augusta strong, stay at home, stay safe. Sheriff Roundtree.
Thank you, Mr. Mayor. Thank you all for coming today to help kind of spread the awareness of what we're trying to do here in Augusta, Richmond County. First of all, I would like to thank the citizens of Richmond County who have voluntarily complied with the shelter-in-place ordinance. We've made great strides as this emergency has went into play, but we still have some more work to do. Speaking directly from the law enforcement component of shelter-in-place, been some misconceptions as to what shelter-in-place does. Because of the governor's executive order was quite long, but it's 4 basic exceptions. And if individuals follow these 4 basic exceptions, not to leave their homes, then we'll be in a much better place. I think we're close to mitigating this virus, to the fact that we can start looking at next steps. We're not there yet. Again, as the law enforcement component, we have been instructed to provide warnings at first and awareness before we take any criminal action. Those exceptions for the shelter in place, there are only 4. And if you do not fall in this 4 category, then you are to remain in your home or place of residence. And those are engaging in essential services, working in critical infrastructure, engaging in minimal basic operations, or performing necessary travel. As the mayor said, to and fro the grocery stores or pharmacies to check on and to provide aid for a sick or elderly family member, those are considered necessary travel. Without those 4 exceptions, you are to remain in place. The governor again has directed us to provide warnings and education, but those who are found in violation of the order will be guilty of a misdemeanor of reckless conduct. Reckless conduct. And that is important to the fact of the charge is the fact that your actions are putting others in danger, in jeopardy. That's why that charge is so significant for any other criminal charge, the fact that your actions, by you not adhering to the order, by social distancing and mitigating the spread of this virus, you are putting others at risk. And that is what we don't want to do. Now, again, we have been great stewards of the fact that we have limited travel, but as these last 10 days, we have been monitoring the roadways. Our biggest problem still remains large groups of 10 or more still congregating in certain social activities. That number has dropped some, but is not where we want it to be. Constantly we have patrols who are designed to go out and try to observe these groups and try to provide guidance and warnings. As of today, we have not written any citations and as it relates to the order. As I said the last time we spoke, it is my hope that we do not have to issue any, and we don't have to take additional resources from active criminal investigations to enforce this order. As far as the monitoring of the traffic, what we have seen since the beginning of the crisis, the road traffic of 3 major fairways, I'm pleased to say at Riceboro Road at I-520, traffic has dropped significantly in a reduction of 42% since this emergency has started. The other 2 major fairways, as far as Washington Road and Berkman Road and Riceboro Road, and Winter Spring Road at Tobacco Road, those traffic has only dropped 17%. So we still need to see that there are individuals on the highways that we do not feel need to be traveling except for those essential services. We will continue to monitor those along with traffic engineers providing us updates, and our deputies give me daily briefings on any activities that we do as it relates to the enforcement of this order. We have been in touch with many of our spiritual and religious organizations. The good thing about it, especially this past Easter Sunday, that they have made inquiries to us as to what kind of services they can provide. Many had asked to perform parking lot services. Again, that is in violation of the order. And we've told them that we cannot give you permission to violate the order. And most that we found have complied. And we're very thankful for that. But we're going to continue, have to continue, these same practices that we're doing until we can get to next steps. And again, we're not there yet. Again, this is 10 days into it. This is still part of our warning and educational phase, but I can't stress enough the 4 reasons, exceptions to shelter in place. I know there is a large contingency of individuals who just feel that they need to gather with their family members. I understand the feeling. I have a very large family. We are very social. I constantly have to remind my family members, stop gathering. Will be a time when we can get together and we will celebrate. We will celebrate Easter at another time. We do plan a big events that I'm a part of, and we will celebrate at another time, but we will celebrate. So that is on a personal note. So if I'm telling my family members it's time to stop social gathering, that's what I'm asking the citizens of Richmond County to do, so we can get those resources of your sheriff's office focused on the reduction and the continual reduction of crime within that area. Again, the proper charge would be reckless conduct, and I can't stress it enough, is that your actions are putting others in danger. So if you're not doing it just for yourself, let's do it for the other people who are in this community who are following the guidelines. We're all in this together. We will get through this together. As the mayor said, we will be coming back each week. I'll be providing updates. If those statistics change, I will definitely let the public know. But I want to thank the ones who are, in fact, have adhered to and are continuing to adhere to the shelter in place. But again, our main problem now still remains the large gathering of groups of 10 or more within the city. And that is what we're asking right now that we really need to focus on. And then the travel, I think once we do that, then the travel numbers will also go down also. So thank you, Mr. Mayor.
Morning. So as you know, our case counts have continued to rise as we expected. The most recent information shows Augusta Richmond County to have 156 cases, and the total group of the East Central Health District, which is 13 counties, has 341 cases. Our main emphasis right now is still on trying to encourage as much compliance as possible with the community mitigation strategies that you've already heard about. The shelter in place, the hand hygiene and other strategies that a person can take, and environmental cleaning are still the most effective ways we can all work to limit the spread of this virus. It's particularly beneficial because regardless of whether people have a test status and regardless of whether people have symptoms, those measures will work to slow the spread of infection, and that is what makes them the most key element that we have when there's widespread community transmission. I think also they are the way that we will most quickly get back to a more normal status. So although they're disruptive now, I really want to encourage everyone to adhere as much as possible. We believe we're on the front side of the peak of infections in Georgia, and so this is the time to pay particular attention to these measures. Even though they may be difficult at times, this is what's going to have the best effect for us. Just a couple of other particular issues. The testing update. Testing continues to expand in Georgia, and criteria for testing have been loosened to allow more individuals to test. This is mostly a function of the fact that we are starting to see some additional resources in terms of swab sets and other reagents to allow us to test more people. Also, the Department of Public Health has initiated a mobile testing site or sample collection site, which right now is deployed in Burke County in response to an increase in cases there. We want that site to be able to move and go wherever there may be a hotspot or a potential hotspot developing so that we can offer testing where it's needed the most. As far as data and information, you probably have seen that on the Department of Public Health website there are several additional data elements being reported. This is part of an ongoing effort to expand the amount of information that we provide about the infections, and you will continue to see new elements added. I anticipate new elements being added very soon. We obviously have to make sure that anything we add is working correctly and the information is reliable, because we want people to be able to use it. But you should see even more things added to that site. And then finally, I want to mention about long-term care facilities and what's going on there. Obviously, there have been a lot of outbreaks across the state in long-term care facilities, in particular skilled nursing facilities, and some here. But the Department of Public Health, in conjunction with partners, are working very aggressively on these. This is an area we've known long-term care facilities were an important area here from the beginning, and they've got very rigorous infection control guidelines that we've been working with them on all along. Once there are cases in a long-term care facility, those are even ramped up further to a higher level. Right now, there's a team from local public health that's making contact with every skilled nursing facility in the district twice a week to find needs and to carry information to them. In conjunction with the EMA office, that's being expanded to personal care homes, which are far more numerous. And so that effort is now going to grow to include those places. We have National Guard resources that have been deployed for cleaning. We've arranged and helped facilitate several infection control consults with infection control specialists at the Department of Epidemiology in DPH. We continue to provide protective equipment to long-term care facilities, one of our priority areas. So we are extremely active in this and doing everything we can to help these places protect the residents that are there, because we know that they are at higher risk of a bad infection from COVID-19 should they get it. Thank you.
Good morning. A brief update, as Dr. Goggins stated, as of 7 o'clock this morning, Richmond County has 156 cases and 6 deaths in Richmond County due to COVID-19. To date, we have requested personal protective equipment for the fire department, the sheriff's office, the Richmond County Correctional Institute, the marshal's office, NSA Georgia at Fort Gordon, the city of Hepzibah, the city of Blythe. We have requested ventilators for Augusta University, University Hospital, and doctors' hospitals. We also requested the National Guard to support local nursing homes with manpower and cleaning. We continue to receive PPE donations from our community, and we're grateful for the community and some businesses that have stepped up and offered us cleaning materials, masks, and other things that we can use for our employees to assist through this time. Each week we host a planning conference with all of the hospitals in Richmond County to discuss their bed capacity, how many ventilators they're using, and their immediate needs, and how us as EMA in the city of Augusta can support them. This week we will start working with the Department of Public Health and calling all of the nursing homes, which we think is approximately 50 or so, and all of the personal care homes, which number doubles that, and assuring that their staff are educated, ensuring that they're practicing appropriate procedures for sanitation and keeping their clients and their employees safe. In addition to that, as you know, this past Monday, as we started into Monday morning, we had very minimal damage due to that storm that came in. None of it affected any of the personal care homes or had an effect on how we respond to COVID-19 at this point. The storm kind of came through the south end of Richmond County, crossed over Highway 25 and kept moving. So there's very minimal damage based on the past weather that we had this past weekend. And with that, Mr. Mayor.
Yeah, we'll take questions.
So what exactly are you guys doing to address the fact that there was an outbreak at Windermere Healthcare Center and there's another, and what will you tell the families who have people there?
So we have been in conversation with the staff and the administrator and operators of Windermere. We have discussed with them what are their procedures, and they are assuring us that they are contacting the families, and we're still waiting for them to submit to us what their procedures are as to how they are notifying the families of the residents that they're taking care of there at Windermere.
Do you have a deadline for that, when they have to submit that to you?
We're asking for it as soon as possible. And I had that conversation with them last week. This weekend when we went and took a look, and we're still waiting. I'm still somewhat waiting, but they have assured us that they're letting the family members of the residents know the status and what's going on with their loved ones that are located in that facility.
And as of this morning, you guys are saying Augusta has 156 COVID cases. That does not include Windermere, because if it does, that would mean the bulk of our county's cases are at that nursing facility.
The numbers that we are presenting to you is the confirmed cases that come from the Department of Public Health. So they test here locally, they send it to the state, and then the state confirms those tests, and they put it in their data and send it back out to us. So it's a fluent moving thing. So tests that are done at Augusta University and some other locations, if you're counting all those numbers may be significantly higher because they have not yet went through that validation process through the Department of Public Health.
Well, there being 4 deaths at Windermere, are you doing more aggressive tactics? Some people are calling for the place to be shut down and the residents to be moved somewhere else. What are you doing to be a little bit more aggressive?
So what we did is, based on some of the complaints, you know, as some of you already know, that we went over there Saturday to look for ourselves. We did that based on the complaints that we had heard, and we went in to see for ourselves not just what the staff and the administrators of Windermere were telling us, but we wanted to take a look ourselves just to see what was going on. Nursing homes, personal care homes fall under the Department of Community Health, not the Department of Public Health, 2 different departments. And so we are engaging, yesterday and today, we're kind of trying to find out and engage with the Department of Community Health to what limit and to what can be done. We definitely don't think it's wise to just go in and shut them down or try to, which we'd have to see that if we even had that authority to do that. I don't believe we do. That would be with the Department of Community Health. But the other issue that would raise would be you'd have to find locations for the patients that are there or the clients that are currently in those facilities. So our goal right now is to assure that not just that facility, but all facilities are practicing appropriate sanitation processes and keeping their residents as safe as possible. If you have that many residents that are at Windermere and you walk in and try to close them down, you have to find other locations for them to be. And that would be very difficult to do right now because not a lot of other nursing homes are taking any other patients in at this particular time. And to take in a patient that you know is COVID-19 positive into your facility. These are private entities, so it'll be very hard to get them to take in a patient like that. So at this time, we've called the National Guard in. We've made that request up through GEMA. They are coming in. Some National Guard folks showed up yesterday, and they will be working with the staff and educating the staff in the facility on sanitation methods, as well as assuring that they have the appropriate staff to help move patients around, treat the patients that are there, and keep the facility clean. So those resources from the state will be coming to assist us with that.
Let me add something as well, Chief James, regarding that. And that's that on April the 8th, many of you may be aware that the governor issued an executive order with a focus around ensuring the health and safety of both employees and residents at our nursing homes and long-term care facilities. With that, as you've heard from EMA Director James, that provided resources up to and including the National Guard to come in and help with sanitation, more importantly, cleanliness. I think one of the challenges that we see all across the state of Georgia, and it's not just Windermere. Windermere just happens to be one of the facilities of many in the state of Georgia, and certainly here in Augusta, that can find themselves at this place. What you've heard is that we don't want to move individuals because you then run the risk of further contamination and exposure at other facilities. And to that end, again, all of those facilities fall under the authority of state regulated entities, i.e. the Department of Community Health, as you've heard. But without question, this has been one of the key priorities of Governor Kemp's efforts around trying to stop the spread of the virus. The efforts in Albany, Georgia, the efforts in Rome, efforts in other locations across the state, and without question, here in Augusta. And so I think what you're hearing from the city of Augusta in partnership with the Department of Public Health, who is on the front lines with us, as well as EMA, is that out of an abundance of caution and, more importantly, attempting to be proactive today and going forward, is that we, in yesterday's call, identified not only a strategy and expectation for all of our nursing facilities to employ the same practices that you see in the hospitals, to gown up, to wear face masks. All of these guidelines are coming from the CDC, and these are the appropriate measures that are being taken at our primary health care facilities, and they should be employed at all of our personal care, nursing homes, and long-term care facilities as well. And so that's what you're going to see from a response perspective. Those efforts in partnership with DCH, while we, again, don't have authority promulgated over to us from a local perspective, we believe that it's important for us in our own community to give guidance and direction when necessary about how to keep people safe, employees and otherwise, and knowing that as the governor has deputized our sheriffs across the state to use them as the enforcement arm when we don't get the type of willing compliance that we need to see.
So what will you tell family members who have family members in those nursing homes? What should they do? Should they just sit at home and wait?
Well, I think the guidance that you've heard, again, as EMA Director James has said, those entities, and in this case, Windermere, we can be very specific about this. They are charged with having to communicate with the families of those residents at that facility. That is their due responsibility. As we understand it in our conversations, they are making those calls. They're navigating through that. And again, because of the nature of this, we certainly want to extend our sincere condolences to the loved ones who have been lost as a result of this. But that facility and its management has the responsibility of communicating. That is not within the purview of the city of Augusta. Our response is, again, trying to provide for the health, welfare, and safety of all of our citizens within the jurisdiction of the county. And as they reside there at Windermere and other facilities like that, management companies have a responsibility to communicate with families.
Can we get some clarification on the timeline from the city's perspective? A lot of people found out from the news. The news didn't find out until Friday. When was EMA or the city officials aware of the first case at Windermere?
Well, I think we were very clear about that. That as we understood that there was concern There was tests being conducted by AU on Thursday. The results of those tests came in, and at the point in time of those positive tests being provided to us, then there was a response not only through the Department of Public Health, but also Augusta University, and our emergency management agency was involved at that time. And so as we're getting information, we're sharing it with the public. I think what you've heard throughout this conversation, not just today, but this is the reality of the process called testing. You have tests locally, and we are now able to do more testing, which is important. Each of our facilities are doing more testing now. Those test results, we give a positive confirmation here locally, and then it's transmitted to the state for validation or verification. Those numbers you see on the state's website, I believe that, and we all understand this, that there are delays in that. Many of you, from a reporting standpoint, locally have said, well, there are some 400 plus cases. That's because the local entities have been providing that information based on their testing. The state's response in terms of putting that information on the state website, there's a lag in that. We, again, are working in concert with our state officials. And again, I think across the state of Georgia, the governor is fully aware of this, that there's a lag in that reporting process, but we're communicating in real time as we know information.
So we've heard we have reported actually that the city is planning to house the homeless population in a local hotel. How is that going? How is addressing the homeless population here in Augusta?
Well, we're going to have a broad conversation about that at 2 o'clock today. The issue of sheltering our homeless individuals is an extremely important one. We've been talking about it for several weeks. We believe that there is a mechanism whereby which we're able to do that. Prematurely, some information was communicated last week. We believe that, again, the conversation today will result in us being able to fully communicate how we're going to shelter the homeless individuals in our community with a very thoughtful and deliberate approach to that. And we'll share that after the 2 o'clock hour.
Moving forward, I have two questions in regards to the nursing homes. One, will the National Guard physically go into other nursing homes to teach them how to clean? And also, do you think it's time to work in partnership with DCH to try and see if you can limit the in and out privileges inside of these nursing homes? And I understand that workers have to go home and see their families, but is it that time to limit in and out privileges of nurses and attending physicians?
Well, I think, so I'll start first and foremost with our hospitals. Our hospitals have already done that. I think the next progression is that the nursing homes will do the same thing. I know that facilities that are run by some of our hospitals have taken those same approaches of where, just as they've done with the hospitals, they've now done that with their nursing home facilities as well, where they're limiting visits. When you think about the fact of what took place at Windermere, do know that many of the employees at these facilities work at multiple facilities. And so you've got the grave concern around cross-contamination or cross-pollination. And so I'm going to defer to Director James to speak with regards to the National Guard because he's working directly with GEMA and bringing those resources to bear. But that's the next progression. When you think about what we are attempting to do in partnership with the Department of Public Health as well as the Department of Community Health, we need that three-pronged effort to include the locals on that three-legged stool in terms of here's what needs to be done proactively to stop the spread of the virus and mitigate any further exposure. And I think that that's certainly part of what you heard Director James indicate, that in our conversation, this is what we're going to be communicating needs to happen at all of our facilities that are nursing homes. And in fact, I think there are almost 50 that are in the East Central Health District, notwithstanding the personal care homes that are in neighborhoods that we need to make sure we include in this conversation. Director James.
And as he approaches, I do want to emphasize not limiting in and out privileges of, yes, the family, I think that's already happening, but workers, like you said, who are working at multiple facilities.
And that's one of the issues that we are addressing. One of the conversations that we are trying to have with the Department of Community Health and actually regulating that. And as it relates to the National Guard, Yes, they will, assist with this particular facility, and as my understanding, any facilities that we need, they will assist us in getting resources there to train staff, help staff manage the sanitation process, and do whatever needs to be done to get any other facility stabilized, so that we can operate and keep moving forward and come out of this. And so most of the nursing homes that we have talked to and dealt with, I will say that anything that we have asked them to do, if they weren't already doing it, we have not had any issues with getting them to comply with our request. And so it has not been a debate or a struggle to get anything done. Usually if we bring it to their attention and we show that there is some concern, then they have addressed those issues as we've brought them to their attention.
Final question.
So the Augusta National did announce last week that the Masters, they're tentatively planning to have the Masters in November. Realistically speaking, can we have a tournament of that magnitude here without a vaccine, a solution to this? Do you expect to be able to provide safely, to ensure the safety and health or well-being of the citizen here in Augusta with so many people coming down here?
It's an excellent question, Yosef. And again, as the team at Augusta National Golf Club, they're monitoring this. And I think that what they've indicated, even in the presser a week ago, is that their intentions, their full intentions, are to conduct a Masters golf tournament in the month of November. And they predicated that based on what we see as it relates to the pandemic. We're all excited about the potential to have the tournament in 2020. I'd like to see that happen, but I know without question, as I'm communicating with members of the Augusta National Golf Club twice a week, generally twice a week, sometimes 3 times a week, that they are going to follow the guidelines that are being provided through the CDC. They're going to follow the directions that the governor gives. They're going to follow the directives that we're given from a local perspective as well. And they've been willing partners in that process. And so they're equally concerned about the health, welfare, and safety of all of our citizens, those who are residents of Richmond County. And while giving grave consideration to that, they're thinking through what other measures could be employed in the event that the tournament were to take place. And so I don't think that there's just a desire just to have a tournament without understanding the dynamics of the state of play that we're in right now. And so I have great confidence that if we are still in a prolonged state that we're in right now, they will make the appropriate decisions as it relates to having a tournament in 2020.
Sheriff, the commission this afternoon is going to debate the hazard pay and only people who have direct contact with the public that we need. And Chief, your office workers would not be getting the $5 an hour pay raise if that is the direction they go. Any reaction to that? If your office workers are coming in, should they get that $5 an hour pay raise?
It's my understanding what they put out was for all department heads to issue directives of what the potential of the employees not coming in. I think by displaying that within our office, and the Chief James can attest to his, and other department heads can do theirs as well. But essential services are the fact of not just law enforcement performance. We have to process paperwork, we have to process reports. So all those in our case have been included, that all my workers are essential to the operation of the Sheriff's Office. So that will be my point moving forward. I'm confident that the commission, based on the information that we provided and that other department heads will provide as well, will also make those same determinations. But they have given the latitude of the department heads to submit information as to why these people are essential and must come to work. And again, within the Sheriff's Office, and I'm only speaking for the Sheriff's Office, each one of my employees since day one has been to work and has to be at work for as warrants do not stop, reports do not stop coming in, case numbers still need processing, people still have to work the radios and process those, payroll and whatnot. So that's our position on it, and we'd be happy to provide more clarity for the commission if they need to be, but that is openly our stance. But again, I'm only speaking directly for the Sheriff's Office.
And I'll add this, George. I think you are aware of the data that was provided in our last meeting. Today's meeting will simply provide clarification. One of the questions that there was no dissension about is our law enforcement and our fire protection and EMA staff. When we began this conversation, it was solely predicated, quite frankly, on those two departments. And so you've seen an expansion of that to some degree, and I want to make sure that everyone understands this, those that are watching as well, as we've given strong guidance that we're following the Department of Homeland Security's and the Cybersecurity and Infrastructure Agency, because they have provided a guideline as it relates to essential services. The better term is essential critical infrastructure workforce, and that's the term that we've used as well with regards to having that discussion internally. So today's conversation will be focused around providing clarity with that, and we'll move forward on this afternoon.
Some employees who are getting $5 an hour, the goal will be that they're not anymore, just for coming to an empty office. At least that's what I'm hearing, that if you're coming to an empty office, no, you don't deserve, or you don't get $5 an hour hazard pay.
Well, again, I want to echo these words to those that are watching, that are listening in, and that all 2,700 employees who make up the Augusta workforce are essential. They're essential in that we can't do the work that we do in terms of providing for the health, welfare, and safety of all of our citizens. It transcends providing law enforcement and fire protection. But every day, we understand that water is life. And so without those individuals on the front lines, we wouldn't be able to deliver water to your house. During this pandemic, cleanliness is tantamount. Without having environmental services, you couldn't have that at your house. And so all 2,700 plus employees that we have that make up this organization are employees who are valuable to the organization, and they're critical to what we do every single day. And these men and women, they suit up, whether they're wearing the blue or whether they're wearing the gray. These are individuals who are vital to the success of our community of some 202,000+ people. And so today we will provide clarification, and those individuals that are going to be receiving that hazard pay will in fact get that. All right, thank you.
Let me follow up, George. I won't be getting it. I know that's going to be another question. I won't be getting it.
Thank you all for your time.